So, how does atrial fibrillation actually cause a stroke? Well, to understand the answer, let's draw a heart and let's review the anatomy. The heart has two top chambers called atria and two bottom chambers called ventricles. There's also another little area over here, and that's called the left atrial appendage. It's kind of like a little pocket. In AFib, blood isn't flowing quite as well through the heart, and this increases your risk of having a blood clot or thrombus, which typically forms in the left atrial appendage. A stroke happens when a piece or all of this blood clot breaks off and moves with the blood flow. It might go down into the ventricle and then get pumped out of the heart. This is a bad scenario because once this blood clot leaves the heart, really, it can go anywhere. If it travels up to the brain and gets stuck there, well, we call that a stroke. The brain is not the only place that it can go. If it travels into the lungs and gets stuck there, we call it a pulmonary embolism. It can even get stuck in places like the kidneys or in your arms or your legs. There are things that can increase your risk of having a stroke when you have AFib. Things like congestive heart failure, hypertension, being older than 65, diabetes, having a previous stroke, or vascular disease, which would include things like a prior heart attack. Head on over to Learnyourself.org to learn more.